button on the top. For those of you not familiar with the Westchester County CoC, we are a public-private partnership consisting of representation from community-based organizations, county and city personnel, and advocates. What we have in common is a goal to prevent and end homelessness in Westchester County. Much of our funding and our operations are tied to requirements set forth by the U.S. Department of Housing and Urban Development, or HUD, and this forum is an example of one of those requirements. We also think it's a really important thing to do to give the community an annual forum to let us know what the CoC should be prioritizing for the coming year. Our purpose today is to hear about where current services fall short, what populations do we need to consider, and suggestions for improvement of our services system. Today's priorities will be brought to our next CoC board meeting to allow the board to discuss these priorities in relation to other data we receive from our homeless management information system database and other sources. That board approved list will become the basis of our decisions for what season for our HUD funding. This funding currently brings over $18 million a year into Westchester County for rental assistance, leasing, and services for people who are experiencing homelessness. The priorities will also be used to strengthen other funding applications. Federal funding sources have realized the scope and reach of our community's CoC and will often ask us for our list of priorities or ask proposal applicants to describe how their proposals fit with their CoC's priorities in their funding applications. Over the years, priorities presented in these meetings have led to the creation or expansion of housing projects and services for LGBTQ youth, survivors of domestic violence, young adult families, foster care youth, veterans, and people with physical disabilities. All that being said, even though we conduct this meeting on priorities at this time of year to prepare for specific funding opportunities, please know that today is not the only opportunity you have to pose questions and concerns to the CoC. You can contact us anytime via our website, which you can see the page is on your screen, which is the Westchester County Continuum of Care Partnership to End Homelessness. The website is WCoChomeless.org. And so you can contact us. There's a contact us page through there once you enter the website. I will introduce each speaker and they will be unmuted. We ask that those calling in to keep themselves on mute when they aren't speaking. Thank you. Okay, so we have, our first speaker is Aishwarya Raja from Mass Transit. Is she there?
Yes, I'm here.
Wonderful. The floor is yours.
Awesome, great. I had a few slides, but I can also just speak for the 3 minutes. So to introduce myself, my name is Aishwarya. I am a 4th-year medical student at Mount Sinai. And what I wanted to talk to everyone today about is an initiative that a team of us at Mount Sinai started called Mass Transit. You can go to the next slide. So some background. So in April of 2020, there was a lot of news articles and studies showing that COVID-19 was having a disproportionate effect on low-income, immigrant, Black, and Latinx individuals, showing that areas that are of lower socioeconomic status were bearing more of a burden of COVID-19. And so a lot of that came down to factors including staying at home is simply a privilege that not a lot of individuals have, and there was an issue in terms of access to masks. And so when the CDC came out with the recommendation that everyone should be wearing masks to prevent the spread of COVID-19, we realized that there was a gap that we as a team of students could fill. So our aim for our organization is to distribute masks and educational materials to vulnerable communities, including essential workers, individuals of low socioeconomic status, and the undomiciled. Next slide. So one big component of our organization is educational materials that are accessible available in different languages, and distill the most important points published by the Centers for Disease Control and the World Health Organization. So we created these quarter cards that we've been giving out to the public, and we've created different versions. So for the general population, it provides information on COVID-19 precautions, the importance of wearing a mask, and the how-tos of wearing a mask, as well as cleaning the mask. And so we wrote this at a 5th grade reading level, distilled all the important facts. We minimized printing costs by making them black and white and quarter card formatting, and made them available in 5 languages to best meet the needs of our communities. Next slide. And so for the undomiciled population, there isn't as much information or as many guidelines on what to do in terms of protecting them. So we took what we could from the CDC website, including information about avoiding public transportation if possible, but we know that's not something that's universally applicable. Wearing masks at all times, and also reporting symptoms to case managers or shelter staff. And so we also made versions for both cloth and disposable masks, because some organizations wanted disposable masks given the difficulty of washing a cloth mask. So we have different types of educational materials for the types of organizations that we've served. Next slide. And so in terms of sourcing the masks, we've sourced them a number of ways, one of them including hospitals that are not accepting cloth masks, or non-hospital grade disposable masks. So Mount Sinai was a primary source of rerouting masks over to us. Local mask makers, coalitions of people that have come together through Facebook and other social media platforms, and small businesses, including fabric and clothing companies that are participating in this buy one, give one sort of promotion at this time. And so we sourced a lot of masks that way. And next slide. So recently we've expanded to Westchester County, and we partnered with community partners within this area, including Hope's Door, WMC Behavioral Health Center, Open Door Clinic, recently Westchester COC, and the medical school that we partnered with is New York Medical College, which has given us a source of volunteers as well as masks through their own avenues. So altogether through our organization, we've distributed around 20,000 masks in East Harlem, the Bronx, recently Westchester, and we've also expanded nationally to different states across the country, distributing another 20 to 25,000 masks. And so, yeah, we just wanted to present to kind of show that we are a resource. You can go to the next slide. And so if you would like to contact us about any organizations in your county that are in need of masks, we are happy to work with them in terms of sourcing masks as well as educational materials. If you know of any sources of masks, you're welcome to reach out to us as well. Our email address is here, and we also have a website. Thank you.
Thank you very much. And Therese, can you also retype that, the website into the chat so it's easier for people to access if you haven't already? I'm sorry. Okay. In the chat, I don't see any questions from Ms. Raja, but I do want to add that our masks came today. So at least they were on my desk when I got here. So thank you very much. We did request about I think we received like 300 masks that we can start with our outreach folks. So we appreciate it very much. They're lovely.
Thank you. Thank you. I will definitely work on sending you a couple hundred more, maybe in the next few weeks. So thank you so much.
Okay, so we can move on to our next speaker, who is Julian Paul Babb from St. Vincent's Hospital.
Hi, I'm not sure if you can see me. I have you on my phone with Zoom. Can you hear me, Annette?
I can hear you. We can't see you, but we hear you.
Okay, I'm not sure why not. I dialed in with Zoom on my phone, but I just wanted to present briefly about our care coordination population here at St. Vincent's Hospital, that some of whom face homelessness, and a number of whom are referred from our inpatient units here at St. Vincent's and are homeless while they're inpatient, and are typically discharged to the Department of Social Services and referred for care coordination at the same time. So we work hard to try to collaborate with these clients, connect them to behavioral health treatment, substance abuse treatment, and also try to help with the referral for housing. So, you know, as an example, we have a client right now that was referred from our inpatient unit, had been living in Dutchess County previously with an AOT order, an assisted outpatient treatment order in Dutchess, and that had expired. And she had relocated to Westchester County, was hospitalized here at St. Vincent, referred for care coordination. And we have been trying to, doing our best to work with her while she's been in Westchester and in and out of the shelter system here. You know, we had an altercation with the client in front of Montefiore Mount Vernon Hospital, where the police had to be called, and the client was hospitalized at Mount Vernon, where she currently is. We're working on a housing placement, either possibly through SPOA, or continuing to assist her with shelter placement, which has been problematic due to the police being called repeatedly at different shelters. But that's a typical example of a client that we work with a severe mental illness that has a hard time remaining connected to treatment, remaining connected to a specific shelter system, or remaining connected to the referral process for housing. So, you know, we try our best to help our clients, you know, develop stability and treatment connections, and work towards housing for those clients that are homeless. Previously, when I was an intensive case manager here at St. Vincent's, I had a number of clients that were referred through the single point of access at the Department of Community Mental Health, who were homeless at the time that the referral for care coordination was made. And I've helped some of those clients get housing with Section 8. One client that was a complicated case was living in a Section 8 apartment that was the Section 8 voucher of her significant other. And she broke up with her significant other, and she maintained custody of the child and was forced to move into the Coachman shelter in White Plains. And I received the referral at that time, and I advocated with that client with the Mamaroneck Section 8 office and a mediator that granted custody of the Section 8 apartment to the significant other. And I advocated with the director of the Mamaroneck Section 8 office, who overruled the mediator and granted my client the Section 8 voucher because she had custody of the child, and then granted a Section 8 voucher to the significant other, and they've both been able to co-parent the child ever since. So that's been a success story, you know, and that's partly with the help of care coordination and advocacy from our care coordination department on housing issues, treatment issues, parenting issues, medical treatment issues. And those are all typical types of services that we help our population with, in addition to housing. So, you know, I've been in contact. I was on the Justice Center webinar last week. I think it was Hudson Valley Justice Center, which is affiliated with Hudson Valley Community, Hudson Valley Legal Services. And they talked about some of the advocacy and assistance they can give for people that are facing evictions or needing assistance. And right now we have a referral for a client that is facing eviction and is allowing the landlord to evict her, even though evictions are stayed right now as per the government's order and the administrative judge's order. So we're trying to advocate with the therapist and the client to explain that evictions are not allowed right now. And, those are typical types of things that care coordinators will do for their clients. I've sent a brochure to Annette for our care coordination services, and that can be posted for anybody that would like to consider making a referral for a client to our department that might be needing care coordination services coordinating, for medical care, treatment, housing, financial benefits, things like that. And, I'm just looking forward to learning more information about the consortium and funding for homeless clients and how we can make use of that funding, HUD funding, or consortium funding from member municipalities, for which a lot of our clients don't live in the member municipalities. A lot of our clients live in White Plains, Mount Vernon, New Rochelle, and Yonkers, which are not member municipalities. But I'm looking forward to finding out how we can, coordinate with those municipalities or the member municipalities to try to, gain financial assistance for our homeless clients. So thanks for letting me share. I really appreciate it.
Thank you. Thanks, Paul. Are there any questions for Paul? And we will share that information about how people can access care coordination services in Westchester.
Thanks, Annette.
Thank you. Okay, our next speaker is Josh Priwas. I see you there, Josh. I can't see too many boxes on my screen, but I do see you.
Good morning. All right, so I have a couple of slides that I'll go through. Thank you very much, Allison, for running through these with me. Again, my name is Josh Priwas. I'm here from Westchester Children's Association. We're a children's advocacy organization that works to fit the needs of children and youth ages 0 to 24 in systems, policies, and programs. And there's actually almost 300,000 children and youth in Westchester 0 to 24. And so the presentation that I have here is going to focus on homelessness among children and youth and sharing some data on trends among children experiencing homelessness in Westchester and the urgency for action for all children living in situations without a stable, safe home of their own. So this first slide here, we have ethnicity and race. There's about 453 kids in total that were identified by the COC, and thank you, Treese Thomas, for helping us get this data for 1 week from the Homeless Management Information System. So 28%, is roughly 126, are Hispanic, and 72%, which is 327 children, school-age children, are homeless. And this was as of April 26th through May 2nd, sorry. Homeless children rate and ethnicity. Black children constitute around 77% of homeless children identified during this week's worth of data. And that's about 309 children who are non-Hispanic and 40 children who are Hispanic. So it's about 349 children in total. And then the second largest group is white children, the majority of whom are Hispanic, and then 12 are non-Hispanic. Can we go to the next slide, please? Thank you. So we're going to get into, this is the same data set for that 1 week. You can see that starting at age 4 and going all the way to age 18, that it goes from about 48 children identified for this week down to 20, and that it's a pretty stable downward trend throughout. Next slide, please. So this data is from the State Education Department, and it's collected by school district homeless liaisons, and you can see that from grade pre-K up till 12, and then including ungraded on the right side, it's about 200 children experiencing homelessness roughly in every grade, from all the way from kindergarten to grade 12. And I have the source for this as well in the bottom. Can we go to the next slide, please? Thank you. So this is a comparison of that data set that I just showed you on the previous slide, which is about 200 children per grade. And so the top line here is that data set total for Westchester County. So all of those grades added together. And the most recent year of data is 2019, so it's 2,719 children identified as experiencing homelessness by the education department, school district homeless liaisons. And then on the bottom bar, you can see this is the HUD count. This is from the COC. And you can see this is actually households, people in households with children identified as experiencing homelessness. So it's 729. But we just showed you data, which was 453 kids identified, and that is a little bit lower because it doesn't include parents in that count or guardians as well. Next slide, please. So you saw on the previous slide that there was a pretty significant gap between the 2,700 or so and 729. The biggest source of that gap is the doubled up population, and this is the population of children or adults for that matter that lack housing of their own and they share housing with others. And so this is about almost 1,800 children in 2018, 2019, compared with 910 identified in a shelter. And so this total really accounts for the majority of children identified by the education department as doubled up and as sheltered. And that's really the biggest source for the whole total. And can we go to I believe it's the last slide. Thank you. And so during this time of COVID-19, the continued need for action for racial equity and in general, as we all move forward in the world, doubled up situations are dangerous. And we're looking at a slide here that is really speaking to the severely overcrowded population in Westchester. We did it by 10 school districts, the largest 10 school districts, and you can see Yonkers on the left and going down on this chart to Bedford. We also have the percentage of overcrowded rental units on the chart on the right. But as we're thinking about doubled up and the need for action during COVID and trying to ensure that people have a safe place to quarantine and isolate and recover, there is absolutely a need to explore this population and try to meet the needs of the doubled up population, specifically for children, but all adults as well. And that really plays out in severe overcrowding. So I appreciate your time, everyone, and wishing everyone a good day. Thank you.
And that we
Thank
have
you,
one
Josh.
question.
We have one question. Sorry, Therese. I did see it. One question was, why is Yonkers so high? Do you have any thoughts about that?
Yeah, I'm not an expert in Yonkers. I'm sure there are people on the call who definitely know trends better than me, but what I'm seeing, I know Yonkers has a population of about 200,000 people, which is the largest in Westchester by a lot. It also has more housing units in general. I think there are about 40,000 rental units in Yonkers. So if you think about the proportion of that, which we have on the right side, the percent of overcrowded rental units in Yonkers, it's only about 3%, which is pretty normal for the other municipalities and districts here. But it's just that Yonkers has so many more units, which is why it's a lot higher.
Okay. Any other questions for Josh? Okay. Thank you. Our next speaker we have on our list is Athena Dent. Who we're not.
Yes, I'm sorry. If you see Daniel Z. Lee, that's my son. So my
Okay, so that's you.
Yes,
That's
I'm sorry about that. He did a lot of homeschooling on Zoom. So that's the reason why his name is up on the computer. Good morning, everybody. How are you?
Good morning. Thank you for joining us.
Okay, so I had mentioned something in the chat box. I'm actually originally from the Bronx. I moved to Yonkers. I lived there for 14 years, and I currently live in Tuckahoe. And one of the things that I definitely agree with, that yes, the homeless situation has definitely skyrocketed, and it needs to be addressed. One of the things that I saw on a daily basis, and I actually saw as the years went by, the increase of homeless people in places such as the library. Basically, they're bringing their belongings, they're there when the doors are open, and they remain there until the library closes. And as we all know, Westchester has one of the highest real estate brackets in the country. But with everything, there are solutions. It's just a matter of funding, who's willing to put paper to pen and strategize and actually put things into action. So I've seen other modules that have been very successful in other countries that I'm sure can be implemented here in the United States. And one of them that has been successful in addressing homeless populations among low-income people and homeless people such as veterans, young people who are living on the street. It's called module structures. And these have been built in various places such as London, England, where they have put these kind of buildings up for young people who were homeless. And it was actually an initiative through the YMCA. There also have been built in places such as Vancouver, Canada, which has been very successful. The great thing about these homes is that they are cost efficient, they're energy and time efficient. The average module that normally are built is anywhere from 2 to 12 stories, and they cost about $200,000 to build, which is actually half the cost that it would cost to put up low-income housing. And what they're affordable prefab buildings. They're actually shipping containers that are renovated and they're made into buildings. They're very, very structurally sound. They're actually very colorful. They're environmental friendly, and they're affordable, which is the main thing. They're affordable. And the reason why they've been so successful is that the local and the government, they sat down, they realized that not only were they convenient and not costly for the funds that were needed to build them, but the fact that they actually were able to be structured so that it will be able to house as many homeless people as possible. One of the places that they also put them in that addressed the homeless situation with veterans was in California in Orange County. This was done back in 2017. They were able to house 205 homeless veterans. Beautiful structure that was done. They made sure that they had on-site services for the veterans, such as mental health services, making sure that they had recreation on site, that they dealt, making sure that the veterans were getting social, SSI or whatever financial means that they needed. This can be done here. Living in Yonkers, I saw many abandoned buildings which were turned into high luxury apartments. And my thing is, I understand there's a need for people wanting to live better, but homeless people deserve to live better also. So there's no reason why not just the local government, but the federal government can put funds towards these module buildings. If they're successful in other places around the world, they can also be successful here. And one of the things I also wanted to mention that the module buildings, the containers come from China, but now what's happening is they're able to obtain them here in the United States. So, it can be either or. So it's not very difficult to obtain. You have a lot of places, especially in Yonkers, where you still have a lot of abandoned lots where these kind of homes and housing can be put up. So, I'm hopefully not, in the near future, really now, that we can hopefully, put our heads together and get these kind of modular buildings built. They're sustainable, and they would definitely help resolve the issue with the growing population of the homeless. All right, thank you, everyone.
Thank you. Thank you very much. Do we have any questions? I did see, thank you, Legislator Mayor, for the information that you posted in the chat. But if anybody else has any questions for Ms. Dent? Okay, we are rolling right along. Our next speaker is Tyrone Glover from the Leverage Credit Recovery.
Good morning.
So, okay. Good
I hope you
morning.
can hear me. Perfect. All right. So yes, my name is Tyrone Glover, and I'm the CEO of Leverage Credit Recovery. And as you can see, I'm a dressed down individual. I want to thank everyone for taking the time to share your thoughts and understandings with us this morning. This really means a lot to me because it's now showing that our community is now coming together, or our communities are coming together with ideas of how do we recover. What are we going to do to make this process easier, not just for our homeless population, but for everyone? This is a time for reckoning. This is a time for reconciliation. This is a time where we have to come together and decide what are we going to do moving forward. Now, I'm reading the new book by Eddie Glagg, Begin Again, and I think everyone in this forum, please go to that his website, Eddie Glagg Jr. It's a James Bowen kind of autobiography, and it is really inciting about what was and what is and how we now take advantage of moving through this difficult time that we find ourselves in. And there was one passage in there that made the most sense to me, and I really just wanted to share that with you. And it said, we must tell the truth until we can no longer bear it. This is real, folks. The pandemic is real. I believe what has happened has allowed for us to literally pull back all the covers, open up those closets, look under those rugs that had a whole bunch of dirt and debris under there, which we have so often walked around or walked over instead of removing it. So what we are offering to everyone taking part in this Zoom is our services to your community, your neighbors, your friends, your loved ones. What we're missing here is a financial component. We're looking to so many other areas, whether it be the government, whether it be our employers, for this financial component, and a lot of it can come from ourselves. Now, unfortunately, the video that, or the slide that we have here, it doesn't have the items that I wanted to share, and that's perfectly okay. Anyone who wants to reach out to me at Leverage Credit Recovery, please do. I'm a soldier. I've served my country. I'm an educator. I love being able to teach. I teach young minds. I teach older minds. What I believe is I was created for this very time in history, as we all are. Those who are partaking in this Zoom right now, you're the standouts. You're the ones who took of your time to join us today and literally say, I can make an impact with my voice. Well, I'm asking all of you now to do that. Make that impact with your voice. Be that advocate, be that game changer, be that what your community needs, and we will get through this recovery. I'm certain we will do it if we want to do it. And that's the biggest part of what I see. It's a want over a will. And once we get out of our own way, we will be able to overcome anything. America is a great country. We've gone through so many things. 1918 was the last pandemic, and we've come through it. We've seen other issues. We've seen other items. And I don't want to really get political in this forum here, because that's not the place for it. This is the place for resolve. This is the place for reconciliation. This is the place for where we can get people together and come up with some concrete ideas. Credit is one of those concrete ideas that I'm sure everybody in this forum knows that without having a decent credit profile, it's going to be very challenging. Are individuals experiencing homelessness equally could benefit from education, things that we did not know. And that's the biggest part of why our financial hardships are so troubling, is because we did not know. we had information, but if that information is so convoluted, or it's more to the fact that it's for those who have such an extensive educational background, for them to only be the ones to understand it, then we're going to have these issues. So I ask everyone, please, as you listen to all the presenters, as you get your questions, I'm begging all of you, please reach out to everyone here and let's share in our ideas. This cannot be any longer well said, and we need to start moving towards well done. Our communities are suffering, and we see that suffrage, and there are a lot of experts, talented, well-educated, smart individuals who are here today presenting and also listening. And I'm now asking of you to be that voice for your community, because I will be that voice for my community. And together, I'm certain that we can get through whatever it is that we might be dealing with. With that being said, thank you so much. Everyone, please continue to be safe. Wear your mask, 6 feet distancing. Do your part. Thank you so much for my time.
Thank you. Thank you very much. Does anyone have any questions for Mr. Glover? Thank you for your positive words and your positive attitude. That's what we need. Absolutely.
Absolutely. Thank you so much.
Thank you. Our next speaker is Carl Bertrand, who's representing Program Design and Development.
Thank you. Good morning, everyone. What I want to talk about today is the importance of doing COVID testing in the homeless shelters in Westchester, particularly among the single shelters. The single shelters have dormitory-style sleeping, shared bathrooms, small common areas, almost no access to outside areas. It's very difficult to do social distancing in that kind of setting. What our shelters do is they take temperatures at the door and they ask whether you've had symptoms, whether you're currently having symptoms of COVID. And 3 months ago, that made sense. But data has come out across the country that shows that symptom-based screening is not appropriate for homeless shelters. So in early April, Boston tested the residents of a large homeless shelter, the Pine Street Inn, nearly 400 people. What they found was that 146 tested positive, and none of them were showing symptoms or had a fever. They were all asymptomatic or pre-symptomatic. And the director of the healthcare for the homeless program there said, all the screening we were doing before this was based on whether you had a fever above 100.4 and whether you had symptoms. How much of the COVID virus is being passed by people who don't even know they had it? We're doing that exact same kind of screening here in all of our family and single shelters. In response to those unexpected findings, Boston screened 1,000 homeless people over the next few weeks. And what they found was that 25% of the homeless tested positive. A week or so later, the CDC did an early release of a study showing the results of COVID testing nearly 1,200 residents and over 300 staff in 19 homeless shelters in Boston, San Francisco, Seattle, and Atlanta. And what they found was that rates among the homeless were as high as 17% in Seattle, 36% in Boston, and 66% in San Francisco. And prevalence among staff ranged from 16% in San Francisco, 17% in Seattle, and 30% in Boston. They found in Atlanta, even when shelters had had no known contact with COVID, they still had 2% of staff were positive and 4% of residents. So what the CDC concluded, that, quote, the testing of all residents and staff members, regardless of symptoms, at shelters where clusters have been detected should be considered. And if testing is easily accessible, as it is now in Westchester, regular testing in shelters before identifying clusters should be considered. Testing all persons can facilitate isolation of those who are infected to minimize ongoing transmission. And then the National Healthcare for the Homeless Council agreed, said that public health authorities and emergency response systems in every community should conduct more comprehensive testing among people experiencing homelessness. Westchester is now testing every single person in a nursing home where there is healthcare and private or semi-private rooms. But for the people in homeless shelters, we're not. We're still doing the things that made sense 90 days ago. And until we do testing at least once to see what our local prevalence is, we can only plan the kind of isolation, quarantine, and testing programs by guessing, by blind hope. And we need to actually get in and do testing and see what the extent of the prevalence is. And it's a matter that's particularly important now when there's so much focus on racial equity, because we know that 70% of the people in those shelters are African American and 25% are Hispanic. And there's also a high concentration of people of color among the staff who are exposed in those shelters. We need to protect them by getting testing to see what the local prevalence is so that we can develop an ongoing testing regimen that makes sense for Westchester's homeless. The end.
Okay. Do we have any questions for Carl? Okay, again, please feel free to use the chat. If you are not online and you're on the phone, just let us know.
We do have a question for Carl.
Yes, how, oh, I just saw it and it disappeared, hang on. How can we bring testing on site to our facilities is the question, Carl.
I think shelters should talk to DSS about it. It would need to be done in conjunction with the health department, who I think would be open to it. And if you're in one of the cities that have ESG funding, White Plains, Yonkers, or Mount Vernon, you could also try to get some of the necessary funding to get it tested. I think the thing to do is you don't develop a long-term program. You first do it once to see what the local need is, and then you can determine the scale. But the first step is to do it once. You're right. Judy points out that White Plains does not have ESG funding. The county does. The county planning department does. And then there's a question about what if a symptomatic shelter client refuses to get tested? It has to be voluntary. What you need to do is have outreach workers working with the people in advance to sort of lay the groundwork that it helps protect them, and try to encourage as many as possible to do it. But no one has done mandatory testing.
Okay, did I miss any other questions? I think that's it. Okay, thank you, Carl. So next we have Candace Kane from FSSY. Is Candace there? I thought I saw her name. I do, I see her. I see her, she's muted. Oh, now she's unmuted. Candace, are you there? Therese, do you guys hear me? Yes, okay.
Yeah, I hear you in that. I think Candace may have either stepped away or is having technical difficulties. So we can move on to our next speaker and circle back.
Okay. Sure, we'll move on to Marianne Watkins from Westchester Disabled on the Move.
Good morning, everyone.
Good morning.
For inviting me to this forum, and I've enjoyed everyone's comments and concerns thus far. And I have the privilege of speaking on advocacy on behalf of people with experiencing homelessness while being disabled. So I want to first start out by saying that there's a large percentage in America of populations with people with disabilities that are facing homelessness. And I believe one of the main reasons why they face homelessness is because when they do work, they make sub-minimum wages because of their abilities, which contribute to the higher poverty and homeless rates because they're not making enough to sustain themselves. The second issue, I believe, is because a lot of people with disabilities, they don't have a work background or work history enough to qualify for Social Security disability. So therefore, they fall in the gap of getting SSI. And the average rate for an individual with disability that doesn't have work history, their average income is $783 a month, which isn't a lot. So now we run into the area of affordable, accessible housing. The average rate for a 1-bedroom or a studio apartment, especially in Westchester County, goes for the minimum $1,022 a month. So you're looking at an individual that has disabilities, that their only source of income is SSI, which doesn't total over $800 a month, but they're looking for housing that is in excess of $1,000. So thus far, we have a high rate of people with disabilities seeking affordable, accessible housing. I also believe that there's lack of knowledge concerning what is affordable, truly affordable, what is accessible. So I think there's a lot of discrimination going on because they feel like people are not knowledgeable opposed to their rights and what's out there for them. So with that being said, again, I'm Ms. Watkins from Westchester Disabled on the Move, and my actual title is Housing Advocacy. So my job is to advocate for people with disabilities to find affordable, accessible housing in Westchester County. Of course, we're not a housing agency, we're a referral source. So we have to rely a lot on our counterparts that we partner with. So one of the main things that I do is an advocating for people with disabilities is my goal is to meet with developers, realtors, municipal units, and to develop a rapport with them to express and share the concerns of the income that most people have with disabilities and the importance to offer affordable, accessible housing to these individuals. And then a lot of these individuals, so to plead their case to say. One example I give you that just recently I experienced, I had a consumer, and we'll just say his initials is CB. And he was homeless, disability. He had a stroke. He had a heart issue. He had a defibrillator. He went to a shelter. His defibrillator was stolen 3 times while he was in the shelter. He reached out to our organization because he was in a crisis. This was before the explode with the pandemic and COVID-19. But he was in fear for his life because his defibrillator had been stolen from the shelter because the shelter wasn't adequately prepared to prepare for his safety while he was there. So he left the shelter to go sleep in a car in the streets with neighbors here and there. So I reached out to a municipality and wrote up a nice letter and said, listen, we got to help this young man. Not only did he have a heart defibrillator, but he was recovering from a stroke, mental disabilities, substance abuse disabilities, just looking for help. He just wanted housing, a young man. And of course, the only income that he had was SSI. So working collaboratively with some municipalities, I was able to write a letter and begin to fight for him to get housing. And then COVID-19 came. So where he was scheduled to move into a unit on April 1st, it was pushed back to May 15th. But meanwhile, his doctor wrote me letters saying, I need to get this man off the street and you have to help him. Where our hands were tied. So we reached out to Westchester County. We reached out to some other people saying, well, can we at least house him in a hotel? But unfortunately, because we are post-active opposed to pre-active, it wasn't happening, because the only people that were being placed in a shelter was those that had tested positive for COVID-19, placed in a hotel, excuse me. So only those that had tested positive for COVID-19 were placed in a hotel. So again, this individual was forced to sleep on the streets because he didn't feel safe in the shelters, sleep in cars. Long story short, he's housed now because of the advocacy that I didn't let up, and I will not let up now, because he's just one of the consumers that we deal with on a day-to-day basis because of their income, because of their disabilities. And I believe that developers, realtors, they don't have a realistic look. And I agree with Ms. Dent where she said in Westchester County, because that's where we are, I'm in Yonkers, rental is extremely high. We have a lot of buildings, a lot of vacant units that could be used for housing, but because of zoning codes and the pre-concept of homelessness and people with disabilities, I believe that there's a stigma put on. And so we have to band together. I agree with Tyrone. We have to band together to begin to advocate, being more proactive opposed to post-active, to allow these realtors and these developers that are getting all of this government funding, all these tax credits, to hold them accountable for the things that they signed up for, that they are providing the units that's needed for people with disabilities and with people that have low income, because we have to fight. The fight is great. We know that over 40% of America's population are people with disabilities. So that's why I like to collaborate with each one of you, where we could sit at the table and we could partner with developers, renters, and get them to understand what SSI is, what minimum income is for people with disabilities. And I believe that everyone is entitled to have housing. No matter what their disability is or no matter what their income is, they're entitled to have adequate, sustainable housing. So with that being said, I look forward to working with each one of you, and so that we could get the job done as far as developing a list of developers, reaching out to them, holding them accountable. The municipal housing, Yonkers as a whole, they're allowing all of these developers to come in the area, develop all these high-rise and high-cost housing. They're getting all of these tax credits, and they're not being held accountable. So they write it in the paperwork, but who goes behind to check to make sure that it's being done? That would be me. Thank you for letting me share.
Thank you. Thank you, Ms. Watkins. And thank you for the work that you're doing. And it sounds like, I know that it seems monumental at times, I'm sure. And your approach of working with each individual person is so greatly appreciated by all of us. So thank you very much. Does anyone have any questions specifically for Ms. Watkins?
Yes, hi, it's me.
Okay.
You're muted.
Are you there?
Miss Dent, you're muted.
Oh, can you hear me now? Can I be heard?
Yes.
I can hear you.
Okay. I think my internet is going in and out. I'm sorry. Is Candace Kane available
Hi, can you guys
to
hear
speak?
me? Can you guys hear me? Hello?
Yes.
Yes, you can hear me.
Yes, we can hear you now. A little louder maybe. Just speak up a
Okay, I'm
little
going to try turning my speaker up on my phone, but I think I'm at the max. Can you hear me?
bit. Oh, yes,
Yes, you can hear me. I'm good.
yes.
Yes, okay. So good morning. I'm Candace Kane, residential manager at Family Service Society of Yonkers. I supervise currently 3 housing programs that we have. We provide permanent supportive housing to homeless individuals with disabilities. And we basically always want to advocate for individuals with disabilities that are homeless, as we know that there is a need to house this population. It's very important at this time, more than any time, that we get these individuals out of the shelters and into permanent housing to reduce their exposure to this pandemic of clients testing positive for COVID-19. So we just want to take this time to advocate for those in the shelters with disabilities and say that it can be more funding to expand housing programs like ours to provide more housing and get clients out of shelters and into homes where they're not at such a high risk and are able to maintain their health and receive services that they can benefit from. One creative aspect that Family Services provides is home care. So we do make sure that all of our clients are receiving home care services, which assist them inside of the residence and reduces their likeliness of going to the emergency room and returning back to homelessness, because we're providing services to avoid them being exposed to different things. So that's pretty much in a nutshell. I'm not going to hold. I know we have a lot of people on the line and a lot of people waiting to speak. So that's pretty much all I have to say. Any questions?
Thank you, Candace. Does anyone have any questions for Candace? Okay. I think I saw in the chat that Ms. Dent, did you have a question? Can you wave at me so we can unmute you? Okay, great. Go ahead.
Yeah, everybody just disappeared. Hello. Hold on.
I'm here.
We hear you.
All righty. Oh, wow. I just see myself. I don't know what happened. Hold on. 1 second. Okay. What I wanted to mention was I just wanted to piggyback off of Ms. Watkins. First, I want to say just kudos to you and to everybody who is out there being a lion, advocating for various populations of people, veterans. I am a mother. You probably can see my son behind me. He is on the autism spectrum disorder. Just advocating for various groups of people who cannot defend themselves. We need to make sure those particular luxury apartments that you were mentioning in reference to housing, the developers such as RXR, who just put up the 4 luxury high-rise buildings in Yonkers. They've also completed 2 in White Plains. They're also completed a few in New Rochelle and in Mount Vernon. They need to be held accountable for the 8 to 10% housing that is supposed to be set aside for moderately income people, but they also need to implement a certain percentage for low-income people, and that includes veterans and people with disabilities. I don't know if a particular commission group needs to be developed in order to follow up to make sure that these developers are setting aside these units for those populations, but it needs to be done. And again, I'm going to go back, just briefly to the model structures. These structures are so inexpensive and they're doable. And if we sit down with the proper municipalities, these modules can be put in place so that people with disabilities and veterans and homeless teenagers and the homeless can have housing like everyone else. So let's continue to just band together and put pressure. Thank you so much.
So muted. Thank you very much, Ms. Dent. Thank you for your comments. Okay, thank you, Ms. Dent. I don't know if you heard me.
I heard you. I'm having technical problems.
Okay. Okay.
I'm trying to fix whatever's happening. Yeah.
Okay. As long as we can hear each other, right? So our last speaker this morning is Laura Case. Is Laura there?
Yes. Hey, everyone. So my name is Laura Case. I am a formerly homeless person and an organizer around homeless rights issues. I want to talk today about, first of all, what it was actually like for the homeless folks that I was speaking to during COVID. It was pretty horrific. For the people who stay outside, especially, it's always extremely hard. But you basically had a situation where all of a sudden the few places that they were able to have shelter, like libraries and even laundromats and train stations, suddenly everything was closed. And we know that there were a lot of times over the past few months that even though it was the spring, it was still extremely cold. So there were times where the temperature, like there was that cold snap back in May where the temperature pretty much dipped towards freezing. So there were just all these people just out there. And a lot of places, soup kitchens just closed. In New Rochelle, some soup kitchens stayed open and just did takeout. But in Yonkers, the last soup kitchen, the YMCA, it just literally shut its doors, and you had people literally just starving in the streets. In the shelters themselves, the county had a policy that people were okay if beds were 3 feet apart, as opposed to the 6 feet that was basically recommended by the CDC for social distancing in public. And the justification, I and other organizers were told that the justification for this policy was that as long as people were sleeping facing different directions, like one person's head was facing the wall and the other person's head was facing the hallway, their heads were somehow 6 feet apart, so that made it okay. In the meantime, at least, I was told by the county that at least 70 homeless people and families actually contracted COVID. And the thing that is the most frustrating to me about all this is that every other city and every other like county in, maybe not every, but the majority of other cities and counties throughout the country with significant homeless populations moved at least vulnerable people, at least people with pre-existing health conditions and seniors to hotel rooms, if not their entire homeless community. The state of Vermont moved literally every single homeless person in Vermont into hotel rooms when this first started back in March. In Connecticut, I think it was in New Haven, they moved their entire shelter population into hotel rooms when this first started, and they had like no COVID cases. And the thing that is the most frustrating about this is that it wouldn't have cost the county anything. The federal government through FEMA was willing to reimburse all these costs and did so throughout the country. And I and other organizers like presented this to the county and like multiple times, and it wasn't something that they were willing to have happen. So I think that the lesson from all this is that COVID is not gone. We're very fortunate right now that it's been reduced, and we're very fortunate that we're at a low tide, but we don't know if that's going to last. And I think the lesson from this is that people need to be protected. At this point, we have time. So at this point, like, we need to work on permanent housing strategies now. We need more things like Broadway Manor. Like we need things like SRO housing. We need I like the idea of modular housing. Like we need to get people out now, because this is a life or death situation, and it's just incredibly frustrating when we're not treating it like that, and homeless folks are just, their lives and their health are just not being taken seriously. So thank you.
Thank you very much, Laura. Thank you for being with us and for sharing that viewpoint that's so important. And does anybody have any questions particularly for Laura? She's our last speaker, and then we can move to general questions, which I saw that there were a few in the chat. But please post any others. Okay, so one of the questions I did see, I think the first one that came in, Sabrina asked about what the partnership is doing to look at addressing housing discrimination in Westchester. A couple of things that kind of coincides with what HUD is also asking us to do. In the last couple of years, HUD has put out something, they've developed something called a racial disparities tool to help each COC across the nation do their own sort of exploration of racial disparities in their own COC. And of course, our COC is Westchester County. So we have used that tool, and not surprisingly, we have found what many COCs have found across the nation, is that there is a disproportionate number of African-American people in experiencing homelessness in our county. And so our first step was to employ the tool. The next step is disparities and homelessness in our system, in our own COC. So stay tuned for that. We will be releasing that. I actually have the flyer on in my inbox to review. So we're hoping to get that launched before the end of the summer. I know that a lot of people think that summertime isn't a great time to launch something new like this, but I think we want to get something on the calendar sooner rather than later. So we'll definitely have that information on our website and also blast it out to everybody for those who are interested. Carl, as my co-chair, is there anything you wanted to add about that in particular? We have to unmute him though.
Yes, I had responded to Sabrina privately also that Westchester Residential Opportunities is our major partner that directly addresses housing discrimination. And they do blind testing where they'll send like a black and a white person to the same landlord or managing agent to try to rent apartments, see what the responses are. They also do fair housing counseling. They're a HUD recognized fair housing counseling agency, and they'll do litigation and file formal complaints. I think what they found is that racial discrimination definitely is still widespread in Westchester, but source of income discrimination and is even more widespread, I think, and having children. So there's discrimination against families also. So it takes many forms, and one thing we need to do is make sure that when we encounter individuals who face discrimination, that we refer them to Westchester Residential Opportunities so they can take the appropriate regulatory and legal action to help them.
Okay, thank you, Carl. We have another question about, does the Westchester COC have a legislative agenda, i.e. legal counsel for tenants' percent of income that people need to pay to shelters? So that's a bunch of different things. I think, Carl, do you want to take that one? I know that
we don't, as the COC, have a formal legislative agenda, partly because we are a partnership of many different political entities. And we wind up working more as coordinated individual partners rather than as a group as a whole, taking positions. I think one thing that's many of us have been working on is the right to counsel effort that Legal Services is leading, and many COC members are a part of that effort. That may be one where there's a national movement, a growing local movement, and with the coming wave of evictions, there may be more openness to that than there has been in the past. So we look at opportunities to act and then find the people who are willing and able to pursue them. So we're attuned but not uniform. We don't all move at the same time in the same direction because we just can't politically.
Okay, thank you. And Tyrone had a question, how is the contact tracing working in the county? Do we have enough tracers? Is that what you wanted to bring up, Tyrone? Or was there something else you wanted to bring up?
There was something else I wanted to add to the overall discussion.
Okay.
Can I do that now?
Yeah, sure, go ahead.
Okay, perfect. Again, thank you, everyone. My last point is that, yes, we're talking very much about discrimination. There's a lot of issues that I believe that we might have to unfortunately remove from the conversation to focus more on recovery. I'm very one that looks upon more positive words, more ways in which we could, because a person going through difficulty, the last thing that they want to hear are negative words. And we really, as educators and professionals, really have to look more towards positive understandings. And as I say, credit for me is definitely one of those positive ways of reinforcing someone that you have the control. And I know we are looking to a lot of these outside organizations or even the state organizations to, do what they can. But unfortunately, due to that leadership, it's going to be a bit diluted at the moment. So if we can empower each other, if we can take one or two people and meet on a regular basis, these Zoom calls are amazing. Prior to COVID, really no one did conferencing in this manner. But now that we have COVID, we're all finding ways of being able to reach out to someone. And that same understanding should be given to every single person that is going through something, whether they have to come to my place, whether they have to go to the library. Well, obviously they can't go anywhere in large groups, but you get my point. We know what we need to do. We have the resources and the tools to do it individually. And as we just help ones and twos and threes, we'll get to those numbers that we're looking for. And hopefully by that time, we'll see the recovery that we know we can have. Our nation is a great nation. As I stated, I'm a soldier. I'm someone who served. I understand my oath. I understand that I'm here to protect and serve and prevent harm for all of our citizens, regardless of your African American or Hispanic, white. It doesn't matter to me. I come to these types of situations with love and understanding that I know I can lend a helping hand, and that's all I want to do. And I hope everyone understands that. Please reach out. Let's not just make this a one-time annual type of thing. We know that our citizens are struggling. Let's help them. Let's do everything that we possibly can to help them. And every presenter out there, if you need me, Leverage Credit Recovery is here to assist. A lot of the situations that they're going through has a lot to do with their data. The data is corrupted on their personal side. So we have to look into how do we address those issues. I already know how to address it. I like to call myself the African American Elizabeth Warren. I have a plan for that. Okay, so we have to want to do it. It's just that simple. Thanks again, everybody. Please enjoy your week and your day.
Thank you, Tyrone. And I just want to say that we've been doing this for 9 years, and this is the first time we've done it online and had 62 participants. We usually get between like 30 and 40. So it's really worked out well for us in terms of being able to get more people on the call and really branch out a lot more. So maybe next year we'll do a little of both, because I know for some people it's easier to be in person, or it's easier to get to the library to meet with us as opposed to being online. And then, we may have to have a 2-part meeting on priorities next year.
Well, let's use those resources to the best of our ability, because they are there. We got all these great companies that are putting it out there, Microsoft, Apple, Dell, regardless of what their politics are, but they're giving us the tools that we can now use to assist every single person that is seeking that assistance. There's no more blockage now. We are our own obstacles.
Absolutely, thank you. And I did want to address your question about contact tracing. We do have enough in terms of, that was how we were able to get to phase 3 in Westchester County. So our region did have enough contact tracers. I know that it's happening. So I would assume we do have enough, because I also know some people who have been trained who haven't been deployed yet. So we have definitely, that system is flowing.
Thank you.
Did I miss any other questions?
Yes, Annette?
Yeah.
I see that Nancy Tunis asked if the need for housing for DV victims will be addressed. And one response is it will be if she wants to speak for 3 minutes. Is Nancy still on the line?
She's there.
Yes, I'm still on the line, sorry. I didn't hear you because I had to just step up and take a call.
You asked if the need for housing for DV survivors would be addressed.
Yes,
It's
we're desperate for that. And
so
we are,
so speak for 2 or 3 minutes about it.
well,
If
You
you
have the
can.
floor.
so many of our many of our clients are staying with their abusers because there is no affordable housing or shelter space in the county or nearby counties. And so we're caught in a vice. They know they need to get out, but there is literally no place for them to go. And the county needs to, we have, I think it's 30 shelter beds in the entire county. And some of those beds are given to New York City residents because it's how you fit into we have 2 shelters. And so it's how do you fit in with the population that's in the shelter at the moment. And now the shelters have spacing, so their bed count is even lower. And we have clients that have called us and said, I have a client right now I'm working with. She desperately wants to get out. She knows her life is in danger and she has no place she can go. No place. And we are at a loss as to who to call. We need apartments set aside for victims of DV. Not all of them need shelter. They just need to get out. And the coachman really is not an answer, which is the best we can do right now.
Okay.
Nancy, we actually do have a few apartments set aside in a new project called RISE that's coordinated by Caring for the Homeless of Peekskill, who's on the call, Cynthia Knox, and my sister's place in the county.
Don't you have to be in a shelter and also have a job?
No.
I can respond to that if you like.
Yeah, please.
I can, Allison, I'm here.
Okay, great, go ahead.
Nancy, you can refer your client over, and the best way to refer the client over is through Jasmine at my sister's place, and I can provide you the contact information.
Oh, we have that, okay.
Okay, so what I would do is contact Jasmine, talk to her about the client, and then they will screen her for the program. It may or may not be a good fit, but it's an option, and we have transitional units for people who need to get out quickly, and then we work with them to obtain rapid rehousing, and the program also provides domestic violence counseling and support and employment services.
Okay, so this client happens to be employed, so that would help.
They may well be ideal. So you knew about the 30 shelter beds and you knew about the coachman. This is a newer project that has several components that never existed before. So explore it with Jasmine and see if it works.
I will. I knew about RISE, but I thought they had to be coming out of a shelter. I have a client that's is using RISE, but she's in a shelter at the moment. So
no, we actually made it. We were careful to make it that people could leave in order to be safe, even if they didn't go to a shelter.
Okay, and how many apartments do you have, Carl? Or Cynthia?
Cynthia.
24. The program has 24 overall. And Nancy, you can call me directly at 914-434-0011, or anybody else can as well. That's my cell phone number, and I'm happy to provide sort of like a bigger picture of what we're doing with the program.
Terrific. Thank you so very much.
You're welcome.
That's a good start.
Thank you for raising.
Okay.
Thank you, Cynthia. Thank you, Nancy.
Thank you, Annette.
Before everyone hops off the line, I wanted to just bring up the fact that we really need to make sure that there are more homeless and formerly homeless folks at this meeting. I know that this is something that has kind of been brought up in the past, but next year, I really feel that there should, if it's gonna be on Zoom again, there should be almost screens and all the shelters where people can participate. And if it's in person, there should be a really robust campaign to make sure that folks in shelters know about it and are able to be here.
Yes, thank you, Laura. I know we had that idea. I may have had that idea slightly too late to make it happen. We did invite all the shelters to invite their residents to join in any way that they possibly could. I think it's a challenge with the social distancing, but it's definitely something we want to pursue going forward. So, a lot of times I know sometimes we have these ideas and it's like, a few days before. But even when we first launched our invitation, we were asking our shelter and outreach folks if there was any homeless individuals that are experiencing homeless right now, that if they wanted to join, they could absolutely, and we could either give them the phone number. They wouldn't even need to have the Zoom. They just need the number to call in. So thank you for that suggestion as well. Yes?
This is Mary Ann. Can I piggyback on that if you don't mind?
Sure.
I agree with Laura. I think it's very important that you have the population that's mostly affected by whatever we're discussing. I think it's good to have them in the room. So I would be more than willing to work with you on making this come to pass in our next presentation, because I can definitely have some of my consumers log on because this is some of the things that they always question me about. Is there a forum where they can go to be heard? So I would love to collaborate with you to get some of these consumers in the room.
Great.
Annette, if I may.
To be honest with everyone, there may be people who have who are either formerly homeless or currently on the call, and I just don't know that. We don't ask for that information. We don't ask people to identify themselves. So I'm hoping that there are definitely some names I do not recognize from our typical meetings or from any of our subcommittees. So, so I'm hoping that they are, and we will continue to try to involve our consumers. Right before COVID hit, Carl and Treese and Craig Wong from DSS, or DSS liaison on our COC board, were involved in a communities of practice with HUD that was HUD sponsored, where they participated in very intense 3-month programming of meeting with other COCs across the nation on how to involve consumers more into our services. So we have some plans. We want to launch them, and we're going to do that as soon as we possibly can, get past at least some of the COVID stuff and be able to gather in smaller groups or somehow reach out to folks. But we'll definitely take your suggestions to heart. So thank you very much. I think we're ready to close. We did say 11, so we're going to try to, no, we're not ready. Allison said, no, we're not ready.
No, Damon Marr's been waiting very patiently.
Oh, I'm sorry.
Hi, if I may. Things are happening in New Rochelle. I just wanted to say that, there was a building opened last year after rehab in downtown New Rochelle via West Hab. It's very successful so far. I think it's 28 units, rental units for those in transition from homelessness, and another 28 that are permanent housing for formerly homeless, and again with I want to say specifically with number of DV survivors. Also with some creative financing and with some support from Westchester County, there's an all affordable building with 219 units going up right in the heart of New Rochelle, and it will include a little more than a third families, mostly women, of course, DV survivors. And part of the creative financing is this Empire State Supportive Housing Initiative, where there are various categories, people recovering from drug abuse, or people, veterans, people with disabilities. And in this instance, the particular category is DV survivors who have been through transitional housing and are ready for permanent housing, and will have on-site support from a nonprofit organization. It's actually going to be a partner in the building. New Destiny Homes of the Bronx. It's going to be their first project in Westchester County. And I made sure, as this came down in the Board of Legislators, where I'm the chair of that Labor and Housing Committee, that there was a commitment to go through the continuum of care in Westchester County, so that you know, our local New Rochelle and other Westchester residents would in effect have first dibs, is that the word we use, technical word, on getting into this building. It's still a few years down the road. Everything has to go just right with all sorts of low-income housing tax credits and state tax credits and all that things, but those sorts of things. But it's something I would encourage all of you to talk to your local elected officials about aggressively trying to find the types of contractors who do quality work. You know, the contractor that's going to be on this job has done quality work throughout Long Island and New York City that I want to take a look at by cobbling together all these different sources of funding. You know, and when you go, a lot of someone mentioned, I guess Marianne Watkins, who I want to talk to about the enforcement issue. A lot of the municipalities have this 8% or 10% affordable housing rule, but if they go further with more affordable housing and look to accommodate folks who have these additional needs, there is money from Westchester County, and big money. They're putting $5 million a pop into some of these buildings, as well as federal and state to get stuff done. So to talk to people, you know, talk it up, contact your local elected officials. Thank you.
Thank you. So it's now, oh, it's 11:02. So I want to wrap up. So I want to be mindful of everyone's time. So thank you to everyone who spoke and participated in today's meeting on priorities. As I said, these priorities have been recorded and will be presented to our board for inclusion in our upcoming applications and responses to funding opportunities. If you have any other questions, please check out our website at WCoChomeless.org for more information about our COC news, our activities, and our subcommittees. We also have volunteer opportunities throughout the year, or to contact us with any questions that you may have. So thank you, everybody. Have a great day and take care.